On this episode of the Ask Mike Reinold Show, we talk about Little League elbow.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today. Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We are here, Champion PT and Performance, answering your questions. Anything you want to talk about, sports performance, physical therapy, performance-based stuff, career advice, head to mikereinold.com, click on that podcast link, and you can fill out the form to ask us questions. Let's see, who do we have here today? We have Dave Tilley, Anthony Vedetto, Dewesh Podell, Dan Pope, and Lenny Macrina here for your question pleasures. Lenny, nice crew of students we have right now. We've had some good students lately. I think your vetting process has gone well, I think, Len. They're doing good, but who do we get today?
It's a struggle sometimes, but no, it's always, we always get a good crop of candidates. But today we have Gavin Harden from the University of Wisconsin Badgers, right? Wisconsin Badgers, yeah. Ben, been waiting to make this announcement. Ben Fuggett from Creighton University. It's actually Fujois. He can clarify when he speaks. We have Jacob Kissman from the University of Nevada, Las Vegas. Let's go gamble some blackjack. And Hannah Vicknair from, I had to write it down, the Franciscan Missionaries of Our Lady University. It's a long name. In Baton Rouge, Louisiana.
That's awesome. I feel like we were all in the background at Trump's inauguration, right? Like everyone was just watching our facial expressions during all that to see how. That's what that just reminded me of. I love it. That's awesome. All right, who's got a question today? I was gonna say I was gonna like roll the dice and see who it was. I was gonna say I think Gavin's gonna take the lead today, but let's see.
I thought Hannah would do all four and just make the guys just sit.
Just alpha it up.
Gavin's the veteran student. He's here. He's establishing dominance. I love it. All right, what's up, Gav?
All right, so first question. Derek from Georgia asks, I'm working with a 13-year-old baseball pitcher who's been dealing with Little League elbow since last season. It's been going on for 6 months, and it keeps returning when we start throwing. What advice do you have in order to help him pitch this year?
Good question. I like it. So we deal with this quite a bit, right? It was an interesting part. Gavin left one part of the question out. That was the person, and this is what I really liked about the question. The person wrote, is a really good pitcher, right? Because every kid, and good ad lib there, Gav, every kid that like him and his parent come, they're always like, nah, he's a 13-year-old kid. He's like, he's a really good pitcher. It's like, okay, sure, right? So, but what that tends to mean when they say a 13-year-old pitcher and he's really good, obviously I'm sure he's successful, but I feel like I bet you this kid throws hard. That was like the first thing that kind of came to my mind, or throws hard for his age, right? Compared to those other 13-year-old kids. So let's start with this. I mean, I think we see this, a lot, maybe Anthony, Len, you guys probably see this more, but I think, Dave, I'd like to hear your thoughts on just the healing of this, right? Little League elbow, so it's a growth plate injury, just to be clear. We can jump right to the chase. We don't have to define it. But a growth plate injury to the elbow in a 13-year-old kid. And again, what happens, just to quickly cover that, in a 13-year-old kid, the bone is the weak link, not the ligament, right? So, in adults, as the bone matures and solidifies a little bit, then the stress goes more on the ligament. That's why we have so many Tommy John injuries as you get older. But in that 13 range, and that's probably the highest percentage, like the mean, like we tend to see it in 13, 14. It can be 12 to 16, but 13, 14 range, they tend to get these. So, why don't we start a little bit here, on this type of kid? Why don't we start with this? Why do we think after 6 months he's still potentially having discomfort? Anthony, Len, anybody want to jump in on this one? I'd be curious to hear your thoughts on 6 months. Why?
Yeah.
What do you think?
Yeah, I mean, we don't see this. I guess we see it a little, meaning they have continued pain. But I think for us, it's just kind of establishing guidelines early of, you need to shut down educating the family on what's going on and what potentially led them here and trying to figure out the history. But what could potentially be going on is we're just not giving enough time of bone healing and maybe reassessment. Maybe another MRI is needed or some kind of CAT scan, or, something is more than we think. Maybe a different study is needed. But they sounds like they need more time. And then what's the ramp up process? What are we using for a process to determine return to throwing? And then what does that return to throwing look like? If this kid is 13 and he's trying to, get back, he's probably good and he has pressures to get back from wherever. You don't know what the effort is he's given on each throw. So I think reestablishing the diagnosis, making sure it's accurate, and making sure the areas that were involved are healed. And then what's the process that you've gone through? Meaning, have you gone through a strengthening program? Have you tested strength? Have you looked at a plyometric program to begin a return to throwing program to see if they are ready to put stresses on that area? Then do a slow ramp up of a throwing program. But I would recommend probably at least 3 months of no throwing at all. And so hopefully it wasn't like a 6 week, let's shut them down for 6 weeks and then test it out. Because that's oftentimes what we hear is this 6 week shutdown. I think they need longer, especially these bony issues in young kids. So I think it's probably going to be they weren't shut down long enough, I'm going to guess. And if they were, then is the throwing effort and program appropriate for what this kid is doing?
Len, would you shut him down for 3 months at the beginning, the first time, or are you saying that now just because he's kind of had some, recurrent injuries and it's not going away? Would you immediately go 3?
I kind of do. I kind of shut. I think it's a big thing. It's kind of like a low back, right? Like a stress fracture, and it depends on you. You try to talk to the doc and figure out, how, to what degree the tissue's involved. Is this a big thing? Is there separation? How much separation is there? Is surgery needed? Did they separate the area enough that they have to put a pin in and reapproximate it? That's probably what's going on, and so depending on time of year and the feel you get from the parents, but I try to stick to my guns and talk about 3 months. And that usually could be a reason why my kids that have this don't have recurring issues. We shut it down, we get it done. At 13, he has another 10-year career in his baseball if he can play through college. Why are we rushing and then 4 weeks or 6 weeks to get him back quicker when we can kind of get this solved and move on? So I'm a proponent for a longer course of not immobilization, relative rest from throwing, but they're still doing shoulder, elbow stuff. They're still strength training. They're still doing stuff in the process. But it's like a back. Like backs need 3 months, right, Tilly?
Minimum.
Right.
Minimum. It was like a red flag that was in the question to me, that, he's a good pitcher. To me, that's like a red flag. The first time a 13-year-old, says that or says something like that, you're just like, oh gosh, that means they're probably pushing that,
Right.
And heck, you never know, right? Like the kid could have saw his primary care doctor and not like a good youth sports ortho that understands growth plate injuries well. And they could just be like, just like, let's rest until you feel better and then start throwing. And sometimes we know, like, it lags, right? I don't have this data on elbow, but I know for the shoulder, there has been published studies that show it takes 2.5 months for symptoms to resolve with Little League shoulder. And then most of them don't start playing catch until about 4 months with Little League shoulder, right? And I don't think we have that for elbow, right? As much as the data on that, there's been more studies published on that, but I just thought that was like super interesting. But I don't know, Anthony, from your perspective, I know, we see a decent amount of youth athletes at Champion and kids coming in here. Any thoughts from you on why this kid's having some recurring issues or anything you've seen differently?
Yeah, I definitely agree with what Lenny just said, but to kind of go off a good pitcher that, we have in the description here, he's probably throwing more than any other pitcher on his team, I'd guess, right? So comes down to, a workload issue, I'm sure. Why does he keep getting injured? Like you said, maybe it's not taking enough time. Maybe he's just taking 6 weeks to rest, and maybe we're not doing the adequate things in those 6 weeks to get him stronger, ready to throw again. I don't think you're putting him in a good spot if you just say, okay, we'll see you again in 6 weeks. Let's let this calm down and then trying to throw again. We're just going to keep picking the scab there, right? So like Lenny said, let's give this 3 months, but in those 3 months, let's, build him a strength training program. Let's, use an arm care program. Let's get him ready and then build up from there and see how that goes. But it's also education. Like if you're throwing 2, 3 times a week, which I'm sure he probably is because he's a, quote unquote good pitcher, let's educate them on, a proper, inning usage, pitch count, whatever it may be to really, hone in on this and decrease these symptoms that he keeps having.
Yeah, that's a good point on the workload stuff, and you're probably right. A lot of this is going to be education and just understanding this process. Maybe this kid's rushing it, that sort of thing. Yeah, I was also thinking back to what Lenny was saying here too, and it's funny if he's sore, it's probably in season. It's probably spring, summer, something like that. There's no way we can shut him down and get him back that season almost anyway, right? Like it doesn't make any sense. So you might as well wait longer, right? And kind of get that over with. This kid sounds like he's having some recurring symptoms that happened. It said 6 months. So to me, this is kid. We've seen this. We tried to shut it down. We tried to be careful over the summer and ramp back up in the winter, but it's still there, right? And that's kind of what we see. Dave, you tend to work with kids where their bones explode in gymnastics. But any issue, like I'm sure you have some issues with people having poor bony healing after these sorts of growth plate things. Thoughts from you?
Yeah, for sure. So it actually ironically works out because Monday night I evaled like a 14-year-old like level 10 gymnast. It's like the highest before college. So she's like really, really talented. She's like a phenom, right? Similar to this kid who's probably throwing a ton because he's like an early developer. And there's this concept I try to educate parents and coaches with is like all kids this age who are like kind of early developers or talented, you're running at this intersection between like their talent and their growth. Like it's optimally, overlapping in a negative way for like their health long term, right? So you have someone who's probably really strong for their age, right? They're like 10 to 14 years old. Their bones are very vulnerable, as you said, because they're like spongy bone. They're not hard calloused bone yet. They haven't gone through puberty to solidify that. But also, you got to remember that these people are typically growing like rapidly. So they go through peak height velocity and their long bones grow very, very fast compared to how fast their muscles can keep up, right? So Osgood-Schlatters, Sever's disease, some of the stuff related to TJ or like thrower's elbow in the back, it happens too, because your arms and legs grow so fast, like your muscles can't keep up and it pulls on local spots that are vulnerable. So all this is going on, but as Anthony said, you're doing like a very high repetition count because you're having fun, you're with your friends, you want to show off, you want to kind of do well. And this girl was doing the same thing because she's starting to get into like college camp mode, where like colleges are looking at her when she's a freshman, and they're like thinking about who they're going to recruit in 2 years, right? So you're excited, lots of reps, lots of volume, and it makes a situation where it's almost impossible to keep up with the demands because you don't have enough time to let things heal before you do another bout of stress on the elbow. So 3 times a week of throwing. Gymnasts do about 39 days per week of gymnastics. So every single day, there's no bony healing happening, and you're continuing to pick the scab. So it's tough because in these situations, she was like, "Can I compete for nationals? Can I make nationals this year?" And I was like, "Girl, if you broke your ankle, it'd be in a cast for 6 to 8 weeks, and then you'd go through 6 to 8 weeks of PT before we think about doing sports, and that's the whole season." And that's the same thing for this kid, right? It's like, if your elbow bone is inflamed and not like healing well, we have to go through rest and then a proper recovery. But I just think, unfortunately, when you say like growth plate, some people are like, "Oh, just work through it. It's just Osgood-Schlatters. Like you'll be fine. Just work through it." But that can become like a serious stress fracture and a bigger issue. So yeah, I think a lot of it goes in the environment is not conducive for a 14-year-old who's going through a hurricane of growth to play at a high volume.
Yeah, very good point. I mean, and I think that's part of the education process that Anthony talked about a little bit, and like even alluding back to what Lenny said, I think we have to educate him here. It's like, look, if we don't take care of this right now, and this thing gets worse, and you have a fracture, and you need surgery, you're done for a year, right?
Yeah.
And then that's huge at that kid's level. But also like patient education wise, I think when you first tell me, hey, we have to shut you down for like 2, 3 months, whatever it may be, let's say 3 months, that's pretty daunting, right, for a kid. Like remember, that's a large percentage of his life so far, right? Like he's only 13 years old, so like half a year, is a large percentage of his life. So that seems like eternity for him. The patient education needs to be like, look, but we're going to make lemonade out of this here, and there's tons we can do. We just can't throw, but let's get your body in shape. Let's get your lower half going. Let's like get your mechanics cleaned up as we go through this. Like this is going to be a win for you in the long run, and kind of like motivate them that way. I think that buys them in.
Yeah.
So go. Oh, sorry, Dave. Go ahead.
Just one more thing, I think, because again, these people are like 14. They want to like compete with their friends, and that's all they care about. You have to reframe why weighting is good for their goals. Because, like,
Right.
on the other side of growth and puberty is like all the big skills. You can throw a lot harder, you can play a lot more, and that's what gets them their goal. Just telling them to rest because it's an injury thing, like, it usually goes in one ear out the other with kids that are really excited to play. So just reframe it of what they care about, what their goals are to get more buy-in.
Yeah. And like assuming this isn't terrible. If it's terrible, they're probably going down like the surgery route, right? If they have like a avulsion fracture or something like that. But assuming this is like a lower grade, they'll heal up, in a few weeks enough to like start doing stuff. Dwesh, from your perspective, when we have kids like this and they're training in the gym, I mean, throwing is the thing that bugs them. There's really not a lot of things we do in the gym that torque the medial elbow like that, right? From your perspective, what's a good way to like focus on them in the gym and really take advantage of this time?
Yeah, I think it starts first with just a good general strength training program, but maybe a little bit more biased towards the lower body and core. Right. We know that as far as proper sequencing, specifically for throwing, and honestly for most power based exercises, our power generators are the lower half, our legs, and then our core is kind of responsible for dissipating that energy, or sorry, transferring that energy so that the arm can dissipate it. So a good lower body strength training program, a good lower body power production program, that's where I would start, right? And that's not to say that we're going to just go ahead and neglect the upper body because it doesn't matter, because it certainly does. Like, hopefully this kid is going to get on a good specific arm care program that's meant for throwers, but that also we're doing good general upper body preparation, doing your upper body pushes, upper body pulls, maybe adding a little bit of mass on the body, right? It's a growing kid that's probably starting to approach puberty, so now we can probably start to think about adding some muscle mass now that we have some testosterone flowing in the system. So that's kind of where I would kind of round it up. A little bit of a lower body emphasis, but make sure that we're taking care of core, upper body, a good holistic program, because we know the arm's going to be put under stress no matter what you do. It's, you say this all the time, like throwing a baseball is bad for you. It's bad for your arm. We're not going to change that. But if we can have the stress go a little bit more to your power generators, it should ideally be a little bit less stress on the elbow if you're really weak with the lower half.
Yeah, and most kids are, right? Most 13-year-olds are. And they haven't been to the gym yet. If you look at biomechanical comparisons of adults and kids, adults throw with their arm. I mean, sorry, kids throw with their arm more, and adults throw with their body more, right? And that's kind of what it comes down to. So this is a kid that, he just got lucky probably. He's probably really loose. He's tall. He's big for his age, right? So he had that mobility when he threw with his arm. It came out faster than the other kids. But now teaching him, lower half stuff and actually transfer it, that's probably what's going to really put this kid over the top.
I think one more thing is, in these kids, they don't hurt unless they throw a baseball. So when you're trying to figure out, how are they ready to go? Oftentimes you need time and just, maybe another image and all that, but they don't hurt to daily stuff. They don't hurt to weight train. It's literally throwing a baseball. You can try to do a little valgus torque on them and see what their baseline pain was at the time, initially, and then, monitor as they go forward, but they're not going to hurt. And so you have to keep that in mind too, that it's literally like a UCL. They hurt when they do something usually. And so it's tough to just say, oh, they're just kind of slowly get them back when they're feeling better. You can't, because they're always feeling better. It only hurts really when they throw. So that's another point I think the audience should be aware of as well.
And that's probably what's happening in this case too, right?
Right.
So I like when our doctors, sometimes we'll have our doctors just immediately say, it's 3 months. We're going to get repeat imaging at 3 months. And you know what? That closes the door, right? There's nothing happening for 3 months, and you have to get repeat imaging to get cleared to throw. It just gives the kid now a 3 month, like runway that he can just follow and just say like, all right, I'm going to put my head down for 3 months and let's get over this. So awesome. Great stuff. Good question, Derek. I think that's probably something a lot of people deal with, right? Especially with mild growth plate injuries, like, the lesser extent ones here. It's not about how fast you can get them back. It's about kind of planning for the future. So great question. If you have anything like that, head to the website and click on the podcast link. You can ask away. And please, please, please subscribe, rate, review, Spotify, Apple, whatever. We'll see you on the next episode. Thank you.